Good morning. Good morning and welcome to today's Home Health Quality Reporting Program. We're really excited to have all of you here in the room, and we have about 750 people who are joining us via webcast as well. So we're very excited to have such a large audience for today's presentation. Just in terms of getting started, I'm going to quickly explain to you what we're doing here in the welcome, and then cover a couple housekeeping items. So what we'll do this morning is quickly go over the agenda. I'll introduce you to the speakers, and then we'll do an icebreaker. And the icebreaker is designed to help you use your cell phones and or laptops to engage with the content throughout today's presentation. And I'll explain how that works in just a little bit. For those of you who are here in the room, if you need to use the restroom, if you go out the back doors and turn immediately to your left, the restrooms are located there. In addition, you'll notice that I'm wearing a lovely yellow shirt, not usually my color, but those of us who have yellow shirts are here to help you, in addition to the two folks that are at the back of the, were at the sign-in desk when you first checked in this morning. Additionally, we do have a Wi-Fi connection available to you. The password for the Wi-Fi connection is manager 1928. So 1928 was the year this hotel was built, and that's how they came up with that password. I am going to advance a couple slides. So in today's presentation, we will have 6 separate presentations. We'll conclude with a question and answers and wrap-up session, the formal part of today's presentation at 3:30. From 3:30 to 4:30, CMS will be hosting a We Want to Hear From You session. The purpose of that session really is to get your feedback about the Home Health Quality Reporting Program. That session is intended just for the folks who are here in the room, so we will stop broadcasting at that point, and then we will resume broadcasting tomorrow morning for the second portion of the training. Additionally, I would like to point out that each of you, when you checked in today, got a packet, and in your packet are materials to help with today's presentations. So on the left-hand side, you'll find an agenda for today and tomorrow, and you'll also find the complete biographies of each of the speakers. On the right-hand side, you'll find an acronym list. You'll find the practice coding scenarios for today and tomorrow, day 1 and day 2. And those are designed to be your reference when we're going through some practice coding scenarios. So if you see the choices that you can respond to up on the PowerPoint presentations, and you kind of forget, well, what was that coding scenario all about? That's what you can refer back to once we've advanced the slides. In addition, there's a website scavenger hunt that will be part of the resources presentation this afternoon. There is also a case study that we'll be using in tomorrow's presentation that will help us bring all of these coding tips together, and you'll have an opportunity to use as close as we could come to a real-life case scenario or case study for you to do coding against, and there's a coding sheet that goes along with that. In addition, at the very back, we have an action plan, or it actually might be at the front of your presentation, and you're going to use that throughout the presentations today and tomorrow. There's a different sheet for each of the sessions that we thought might be helpful for you to take notes on. And the purpose really is to allow you to take notes on things that might be important when you go back to your facilities to operationalize what you learn here today and tomorrow. We'll also be referring to it a little bit when we talk about using our audience engagement tool, which would be your cell phone or your laptop. So now on to the icebreaker activity. This is where I'd like to ask all of you to pull out your cell phones, if you don't mind, and open a browser. And once you have that browser open, if you wouldn't mind typing in slido.com, slido.com. And then you'll come to a screen, such as the one you see in front of you. It'll ask for an event code. If you could just type in the word Econometrica, ECONOMETRICA. And this will work for those of us in the room, but it will also work for those who are participating online. So when we do things like knowledge checks and polling questions, or you want to submit questions that are important to you to get answers to, all of that can be done through your phone, whether you're here in the room or you're participating online. So is everybody with me? Can I see a raise of hands if you've got your cell phone out, you've got your browser up, and you've been able to log in? You should be on a slide that basically says questions, ideas, and polls at the top. You want to make sure that you click on polls. And now we're going to try and see how this all works. So I'm reading to you the first polling question, which is, what popular street vendor food was invented in Baltimore? And you're going to have a variety of choices. First choice is A, hot dogs. Second choice is B, snow cones. Third choice is C, popcorn. And fourth choice is D, roasted peanuts. And I see that at least 28 people have responded. Answers are coming in. Many of you think the right answer is snow cones. Give it another moment or two. Close second is roasted peanuts, and hot dogs are sort of in a third place race. All right, we've got quite a few responses in, so let's go ahead and check and see what the right answer is. The right answer is snow cones. So good job for the 50-some% of you that guessed snow cones. All right, we'll try it one more time, and then in the interest of time, I'm going to move us forward. What school of healthcare was first established in Baltimore in 1840? Was it the School of Nursing, a chiropractic school, School of Dentistry, a laser eye surgery? Okay. Oh, nursing is coming from behind there. Uh-oh, it's really kind of neck and neck with dentistry, which seems to be dropping. All right, we've got a number of responses in. So let's go ahead and see what the right answer is. The right answer is dentistry. All right, everybody get how that works? Anybody have any questions? Okay, we're going to use that technique throughout today's program to test your knowledge. So I'm going to go ahead and advance a few slides forward. And now I'm going to explain to you how you can use your phones, either online or here in the room, to submit questions. So the first thing I'm going to ask you to do is register who you are. So you'll see up in the upper right-hand corner, there's a little picture, looks like a head with shoulders. If you would click on that and enter your name, your company, and your email address. And the reason we're asking you to do that is sometimes we get questions and we need to do a little follow-up, and it's helpful to us to know how to get a hold of you. So if people could raise their hand when they've got that information in, I'll take a gauge as to whether or not I'm going too fast or too slow. I see a couple hands going up. Okay. And if anybody needs more time after this to go back, there is a handout on your table explaining how to do all this. So once you've completed your profile, you can feel free to ask questions. We do ask that you kind of wait till the end of the session to submit your questions, because it's very possible that the presenters are going to provide the information that you're looking for, and that will just help us filter through the questions faster at lunch so we can answer the majority of your questions as we go. I'm just going to take a quick look at my phone and see if anybody has indeed submitted some questions. And if questions have been submitted, one thing that you'll notice is that you can like a question. So Ephraim, would you mind submitting a question real quick? And we like you to look at that, and when you see a question come in, rather than retyping it again, like that first question, because the questions that get the most likes or votes are the questions that we're going to try and get to first for you. So it'll help us prioritize which questions are the most meaningful to you for us to get immediate answers to. And so once Ephraim gets a question submitted, then you'll be able to practice liking if you want to. The last thing that I'm going to cover is submitting action plan ideas. So remember I said you have that nice form in front of you where you can jot down ideas of things that you want to do when you get back to your offices in order to operationalize this. We also want you to share your learning with your fellow colleagues here. So there is an ideas button, and the presenters will ask you to use that ideas button to submit ideas about action plan ideas. You can like them just the same as questions, and we'll use this projector to share some of those ideas as we go throughout today's presentations. And I am now going to turn the presentation over to Dr. Juzasia, who's going to go over the CMS, well, she'll welcome you and then go over the CMS Meaningful Measures presentation. So with no further ado,
well, good morning. Hope everyone is having a warm morning, bundled up in this weather today in Baltimore. It's really a pleasure to be here. Again, my name is Rena DeSasia. I'm the Chief Medical Officer for the Quality Measurement and Value-Based Incentives Group. I've been at the agency for a little over 2 years. It has gone so fast. And I'm really just excited to be here to share with you some of the work that we're doing at the agency, in particular around the Meaningful Measurement Initiative. So just for your reference, CMS is full of acronyms, as many of you might know in this audience, but this is just for your reference, and that if you want to look at the presentation later in terms of some of the acronyms I'll be using in the presentation. Pass through this. Okay. So I only have a few minutes, I understand, so I just want to really kind of convey to you some of the important work that we're doing at the agency right now, and in particular around the Meaningful Measure Initiative. So what is that? It's an initiative that we launched in 2017, and the purpose was really to give us a framework and how we think about the measures in the variety of our programs. So one of the focuses that I want to emphasize is the measures that we're selecting to remain in our programs are ones that really directly improve outcomes for our patients. We also have heard from a variety of stakeholders for many years the burden associated with submitting data to our programs. And so we looked at that with that lens as we were looking at the measures that remain in our programs to make sure that what is left is actually leading to improvement, actionability at the front lines. So it was a framework that we used to allow us to focus on the efforts to better align what is most meaningful to our beneficiaries. Why did we implement the initiative? I alluded to this earlier, but it really is to allow for us to address concerns that we've heard repeatedly about that there's too many measures. Why are these measures in our program? Really being able to tell the story, the measures that remain in our programs, why they are there, and to be able to help us stay focused in how we're thinking about moving forward in our next phases of development of metrics that we think that are meaningful, and being able to drive toward higher value of care across settings. So I'm going to move on to just talk a little bit about our 4 strategic goals at this agency. And this really guides everything that we do in our Meaningful Measurement Initiative and across a lot of our initiatives across the agency. But I think I want to emphasize 2 things here on this slide that I think that resonates as a clinician, as well as someone who's also working with an agency, and hopefully resonates with you as well. One is, our strategic goal is to really empower patients and providers, I think we need to change that from doctors to providers, to make decisions about their health care. So whatever we're asking for people to report on, we want to make sure that information is meaningful and actionable, and that really guided our meaningful measurement initiative. Second, we want to support innovative approaches to improve quality, accessibility, and affordability. This really speaks to the initiative of our agency about interoperability and really thinking about how do we collect data in smarter ways. Technology is changing, and I think we're really wanting to be partnering with the industry as we're thinking about ways to get data more smartly, and also to be able to turn that around back to you, to the front line, to be able to use that in a most meaningful way, in the most timely way. And the third and fourth strategic goals briefly is really to improve the CMS customer experience. I think that's paramount. We recognize that it's important to partner with you as we are implementing these programs and ushering a new era of flexibility and leadership. There are many objectives to this Meaningful Measure initiative. I've listed it here, and I'm just going to focus on 2 or 3 things here because I think that's the most important thing, at least for the limited time I have with you. One is, and I've mentioned this already, minimizing the level of burden for providers. In our first phase, we really spent in this last year thinking through that in a very thoughtful way, listening to you, listening to a variety of our stakeholders as we thought about what are the measures that are actually allowing to identify for significant improvement, as well as making sure that we can balance that with the level of burden for providers who are reporting on that data. Our next phase really is kind of thinking through how are we going to get measures that we're now moving into the phase of outreach, of what else do we need to put into the program that we have identified as perhaps gaps in our programs. So those really focus on thinking about the measures that are patient-centered, meaningful to patients and clinicians and providers. We're also looking at things that are high impact. So when I mean a high impact, there's a lot of discussion about thinking about what's value from the patient perspective, from the provider perspective, from the program perspective, the system perspective. All of those discussions are really important as we're thinking about our next phase of this initiative. And then addressing measures that are across-setting. I think that's really key, because oftentimes we think about things in silos, particularly in terms of your experience with one program, but we need to think about care coordination across settings because our patients are across settings. So it's important to think about that as we're thinking of our next phase. And so the work that we did, and just in terms of the background and how we launched this initiative, CMS didn't do it in a silo. We actually relied on a variety of stakeholders that have been doing a lot of important work for many years. And this includes drawing on measure work from the Healthcare Learning and Action Network, from the National Quality Forum, as well as the National Academy of Medicine. And then obviously getting feedback from our stakeholders through our many outreach efforts, also with our sister agencies, including the Agency for Healthcare Research and Quality. And we also have a core quality measures collaborative, and that collaborative is really key in terms of thinking of alignment. We know that CMS is one program among providers experience across a variety of settings and plans, and so it's important to think about that in terms of the alignment of the measures that remain in our programs. In this slide, I just want to focus briefly on thinking about the levers. So we believe that there are several levers that we can use as we think about the Meaningful Measure initiative. One is which, and I think I've emphasized this a few times, is really thinking about engaging patients and providers. So what you'll see from our agency in this next year is really coming to you to hear about what is most meaningful to you as we're thinking about the meaningful measurement areas. We identified 19 areas as we launched this in 2017. We're not sure we have it completely right, but we want to hear from you to see, did we capture those areas? Are there areas that we're missing? What can we refine? But the key principle behind that is to make sure whatever we are keeping within the programs, those measures are actionable and they're leading to an improvement for the care of our beneficiaries. The second point really is around interoperability. Really key and important is to think through when you submit data to CMS, we don't want it to think about it in terms of it's submitted, it's in a black box, so we don't know what happened to it until we get a report, maybe 6 months, a year later, maybe even longer, depending on the type of data. What we're really trying to do is think through how can we get data faster back to the provider. And that's, a work in progress, thinking about working with vendors, thinking through how do we get that timely information back to you, thinking about what type of measures we want to collect. So again, this is a key initiative along with what we're doing with the meaningful measures. I mentioned a few other things, and one of them meaning optimizing public reporting. We know that the measures that are reported, not necessarily, we give reports obviously back to the providers, but there's also this important piece about the public reporting aspect, and we know that a variety of people use that. So thinking through what is the information that's most meaningful to the person who's choosing the provider or the facility in terms of where they're getting care. A lot of work being done at our agency right now on this perspective. And then alignment. I think, again, thinking through if we have a measure in one program, can we find something similar in another setting to think through what is the experience for the patient as they're going through their care that they're being delivered in the care system. So I'm going to focus on 6 areas, and just to give you some examples of those meaningful measurement areas, just so you have an understanding of what our initiative is. One is promoting effective communication and coordination of care. This I actually hold very dear to my heart as an emergency physician, because seeing patients who come in and time again who might not be able to get care, and they just come to the ED because we're open 24/7. It's one of the reasons I chose to practice in emergency medicine, because I felt that it was so important to be able to provide that care that for patients who are not able to maybe get it. We think that we've identified 3 areas here, and you guys we would love to get feedback on this, but the areas that we have identified that we think is important when we think about coordination of care is 1, medication management, and we see that in some of our post-acute care settings. I think across the programs, we've identified that as an important area to be able to measure, because we know there's adverse effects when we're not able to really be able to manage them and know what our patients' medications are on. Second is on admissions and readmissions to hospitals. We have a wealth of information around being able to know that when we actually measure when a patient comes into the hospital, they're readmitted, that it might be an indicator that of excess number of readmissions, whether there's an opportunity for improvement. And third is really an initiative that we're really focusing on now, which is around healthcare information and interoperability, and you'll hear more about this from our agency in the next year or so. The second one is around promoting effective prevention and treatment of chronic disease. So we have, sorry about that. Let's see if I can get us back. I'm having some trouble with the slides. Yeah. And do you mind getting me back to the chronic disease, please? The fancy slides. All right. That's the communicate. Yeah, I need to go back and forward. Okay. Okay. I got me back again. Well, so I'll have this in another slide, but the important part here is really thinking about chronic disease and how we're effectively managing care of our beneficiaries. And we have identified several areas around chronic disease as well. And I have another slide to give you some examples of that from our programs. Okay. And the third one is around working with communities to promote better practices of healthy living. And that's equity of care and community management. And I'm sorry these slides are going so fast. But I will, you should have the slide deck, and it's also, I have some resources at the end for you to be able to take a look at it on our website. We also have making care affordable, and that slide really is around thinking about resource utilization, thinking about cost of care, total cost of care, looking at appropriate use of measures, and we have several of those in our programs at this point, and we're looking to further continue that, because when we're thinking about high-value care, sure. High-value care, it's really important for us to not only just be measuring quality metrics, but thinking about also the cost portion of it. And so there's some work in our agency about that alignment piece. And then the sixth one, I believe, I'm on the sixth area. You can go forward, please. Oh, I think we're good. Yeah, let's just start here. I can just end here. So the last one was about, and it's actually key, is about strengthening the patient engagement, the family engagement, and we have several measurement areas from that perspective, thinking of end-of-life preferences, thinking about the importance of being able to indicate that, patients' voices are heard in terms of functional outcomes when they get a procedure done. And so there's a lot of work thinking about patient-reported outcomes. So I wanted to give two examples of areas that we've identified and how those measures go across settings. So promoting effective communication and coordination of care, you can see that, and as I mentioned, that we have identified three main areas. We have looked at medication management, admission and readmissions to hospitals, and transfer of health information and interoperability. And you can see we have them in a variety of our programs. We have them in the quality payment program. We have them in a variety of post-acute care settings, and I'll highlight the drug regimen review conducted with follow-up and identifying issues. You see them in the IRF settings, in their LTEC settings, home health, and in the SNF settings. Similarly, we have measures around readmissions through our inpatient settings, outpatient settings, and then we're also now focusing, and you'll see in particular with our quality payment program, as well as in our post-acute care settings, thinking about the transfer of health information and interoperability, and using of the electronic health record, if applicable, or other mechanisms to make sure that we can try to capture those elements. And so you see down here again programs that use this that are illustrative of how we're thinking through this. Second, it's around promoting effective prevention and treatment of chronic disease. I know that I was having some slide trouble earlier, but now you can see actually where we're identifying those meaningful measurement areas. So we have preventive care, management of chronic conditions, looking at the treatment and management of mental health, thinking of substance use and disorders, as well as risk-adjusted mortality. One thing that we have heard from our administration is the importance of thinking about the use of opioids at high dosage, and so there's been a lot of work at our agency in thinking through that particular aspect of trying to identify measures that can get to this. So when opiates are adequate to be used, when is the appropriate time versus those that are where there's overuse, and how to get to addressing that epidemic. In addition, thinking about preventive care. Across our programs, we believe that, for example, getting influenza immunizations is critical during the current flu season. You'll see that, for example, in the home health quality reporting program and across a variety of our settings. So I'll end with just saying that the initiative has been extremely focused for us in terms of thinking about the importance of being able to think through what story that we're communicating to you as we have the measures in our program, but more importantly, it's an opportunity for us to engage with you, to think about where do we want to move forward from the agency's perspective, and thinking about the measures that matter, that are the most actionable at the setting for the frontline provider. So the initiative really is allowing an opportunity for us to align our quality reporting programs and helping programs to identify and select those measures. And allows also for us to help clinicians and other healthcare providers to focus on their patients, to improve the quality of care that they think that's the most meaningful to them for their practice and for the patients. It really is for us to be able to capture the most impactful and highest quality reporting areas for clinicians, including specialists. We have used this framework to guide our rulemaking, and you've seen it in our rules for this last year that we have finalized. We are also, looking for our next phase in terms of education outreach, so we'll be doing a lot more listening sessions in this next year. For those that are aware, we have a quality conference every year. It'll be actually at the end of January of 2019. We really encourage, I think registration is open right now. If you're able to make it, we would love for you to come. We're planning to have several listening sessions there. We want to hear from you in terms of really thinking about what we should be doing for the next phase in terms of the areas, as well as thinking about potential developmental areas for metrics within our programs. So I'll end with just saying that we have a couple of websites. I really encourage you to please access this site. It allows you to get a better sense of where we are from the agency perspective in the Meaningful Measure Initiative. We have more FAQs about what we have done up to date with the Meaningful Measure Initiative. It also has the slide deck here, so if you'd like to take a look and see a little bit more carefully with each meaningful measurement area and where it applies to each of our programs. And we also have fact sheets, as I mentioned, when the link is there.